You're tuned in to More Living with Jim Brogan, broadcast live from the Brogan Financial Studios at News Talk 98.7, where old-fashioned values, expert knowledge, and genuine understanding come together to give you the retirement straight talk you deserve. Jim's a former National Advisor of the Year recipient and a financial educator, and he's here today to talk about how you can live out the best years of your life. Jim and the Brogan Financial team have been helping retirees and pre-retirees across the Southeast for over 20 years in their pursuit of financial independence. You can reach them during the week at 865-862-6800. So sit back, relax, and get ready to learn, because More Living with Jim Brogan starts now.
Welcome to More Living with Jim Brogan, where it's all about living the best years of your life your way. This is News Talk 98.7 WOKI. And we're going to talk about Medicare today. Medicare open enrollment started on Wednesday, October 15th, and we have Kevin Kragenbrink with us, longtime friend of the show's and mine personally. He's really spent his life helping people grow. He was a teacher, a pastor, a business coach, and now a trusted guide in the world of insurance. He helps people make sense out of Medicare and individual health insurance. He has over 30 years of experience in leadership and personal development. He brings warmth, wisdom, and real passion for helping people make smart choices that can fit their lives. Welcome back to More Living, Kevin.
Thanks, Jim. It's great to be here. It's been a little while since I've been in the studio here, but I'm really glad to be here today.
Yes, sir. And you've even filled in and helped me host the show before at times when I've not been able, especially back before the pandemic, before they got the technology where I could do the show kind of from anywhere. But you had really helped me guest host the show.
I always enjoyed sitting on the other side of this desk.
Yes, sir. Well, before we dive in, share a little bit about your background and then how you ultimately came around to working in Medicare.
Well, so my background, I spent most of my adult life as an entrepreneur, starting businesses, building businesses, those sorts of things. And then for about 30 years, I turned that business knowledge into helping other business owners grow their business and learning about what was going on with them. And as a part of that process, I spent a lot of time helping those business owners talk about the question of employee benefits and health insurance and those sorts of things. And it offered me an opportunity about a little over a decade ago to actually start a business in that space where we were working with employee benefits and those sorts of things, and really spending some time with the people around those things. And my passion has always been, and when we started our brokerage, the idea is that that insurance shouldn't be about the insurance or the insurance carriers or those sorts. It should be about people. Because people matter, and doing things that really help people understand their insurance, their health insurance especially, and those sorts of things has been what we've been passionate about and what I'm still passionate about. And about 8 years ago now, I moved into the Medicare space to try and understand that and help people get really a better understanding of how Medicare works. And that's really been a very successful and fun thing to do. I really enjoy talking to people about it, trying to take some of the mystery out of it, because quite frankly, if you get out there and if you do your own Google search on it, Medicare is a jungle sometimes and a mystery most of the time to a lot of people. It can be so confusing.
It really can be. And we're going to get into a lot of those ins and outs. Before we get into the Medicare stuff, let's talk about people that looking at retiring early. Because that gap between, their being on their company insurance plan and getting on Medicare, some people have to deal with that, and there's different ways to do that. We know about COBRA and different things like that. But talk a little bit about funding that gap. Is it purely a financial decision? I mean, because you can fund that gap, right? I mean, you can.
You can, absolutely, yeah. Absolutely.
So how good are the choices that are available?
I mean, a lot of that decision is dependent on health status when you decide to retire. If you're healthy and strong and everything is great and everything is good, there are a number of plans out there that are accessible, but they're underwritten, which means you have to go through underwriting. You have to get, they're going to ask medical questions and all those sorts of things. Those plans are oftentimes inexpensive by comparison to other options. But they do go through underwriting, and they can, by law, they're allowed to exclude certain pre-existing conditions.
So what if someone has, most people that are 60 years old have pre-existing conditions.
They do. And that therein lies the real difficulty is, when you're in that place, Then you have to think about, well, do I go look at the marketplace? Because the marketplace does have really good options. And if you're able to go to the marketplace, you don't have to have a subsidy there to get insurance. You can go to the marketplace without subsidies. If your income allows you to have subsidies, then you have that improved benefit where the government's going to help pay some of that premium for you. That's always an option. Those marketplace plans are available. They're good plans, and they have good networks in the East Tennessee region. So I think those always can work out well. But beyond that, beyond the marketplace, there are no, we call that guaranteed issue. There are no other guaranteed issue options in our region outside of COBRA.
And of course, COBRA, most people can go on COBRA for 18 months. 18 months where they pay the premium that their company was paying. If their company had 20 or more employees on health insurance, they're required to offer COBRA.
Correct. And if they had less than 20 employees, then they unfortunately only have a 3-month, what's called state continuation period.
Right. Yeah. So let's start. Okay, so now let's get to the Medicare question. But before I leave that, I just want to mention, I can't tell you how often I hear people say, well, I really want to retire earlier, but I'm going to work to 65 because of health insurance.
Yeah.
And it's really a financial question. I mean, many people can afford to go on the exchange and pay the premiums and do all that and get through that gap.
Yeah.
Right? So it's just a matter of the budget for income planning.
That's exactly correct. And I will mention one other piece about that. The Trump administration reauthorized, and we now have access again to what are called short-term medical plans. And so if you're 62, for example, and you want to retire at 62, you can get a 3-year short-term plan that would bridge that gap as well.
Or you could, I guess, do 18 months of COBRA and then do 18 months of whatever the gap needs.
You could. That's exactly correct.
Yeah.
Yep.
Okay, so then you're getting close to 65. Walk us through the timeline first of what people need to be aware of. What if people are still working and they have insurance, or what if they're not? Just walk us through that timeline and how that works.
Sure. So I usually encourage people to start the clock when they are 90 days before the month of their birthday.
Of their 65th birthday.
Yeah, before their 65th. So if your birthday is in December, then you're going to back up to September.
Right.
And you're going to say, and I'm eligible on the 1st of September to start the clock ticking. And the first step in that process is to contact Social Security. You can either call them or you can go to the local office. You can go on the web, and you're going to sign up for Medicare. If you're not going to stay on your company plan, or even if you are, you can sign up for Medicare even if you're staying on your company plan. And when you do that, you're going to look at signing up for either Part A and Part B, or just Part A. So Part A, that's a part of the original Medicare system that covers hospitalization events and those sorts of things.
And we don't pay premium for Part A.
There's no premium for Part A if you've earned that. You've worked you've earned your 20 quarter credits through work. That is paid for by 100% out of that Medicare money you've already put into the system. So you don't pay any premium for that. And then if you are going to come off of a company plan, or you need to go on Medicare, you also need to sign up for Part B. And there is a premium for Part B.
So let's back up for a second. If somebody's working past age 65, how does their group health insurance usually do most require them to go on Medicare Part B? Talk a little bit about how those rules work.
That's really as much about what company you work for and what kind of plan they have as it is anything else. Smaller companies may require you to come off of the company plan. Larger companies often do not require that. Some smaller companies,
do they require Medicare to be primary, and then
that often depends on the carrier that's the underlying the medical plan.
Right. So the most important thing from my vantage point would be to get with HR.
Yes.
Maybe before that 90-day window,
yes,
maybe 6 months out, or even a year out, and then start having those conversations of what you have to do if you're still working.
Exactly correct. Because, again, you want to make sure that you know what needs to happen on the month of that 65th birthday, because that's a critical date. If you don't go on Part B, for example, you stay on your company plan, you also want to ask HR to show you documentation that that's going to be called creditable coverage. Because if the coverage they have is not creditable and you don't go on Part B, you could be liable for penalties later when you do go on Part B.
Right, and that's very important. Most of the times, though, with group health insurance, I mean, it is creditable, right? And then when you leave work, that's a qualifying event, and there's not a penalty to then come on Medicare.
Exactly correct. And most of the time it is, but I've seen a couple of instances in the past 2 years, actually, in our area, where people thought they had creditable coverage, and in fact they did not.
Now, Medicare Part A, the hospitalization there's no premium for that. It covers hospitalization. Is there a reason, if somebody's still working past 65, is there a reason somebody may not want to come on Part A?
Not in my mind. There's not really a good reason not to do it. That Part A will just supplement their other insurance through their company, and they do no harm to themselves for doing that. And they've just registered themselves in the system. They get their Medicare number up front at that point in time. Now they've got the number that goes with their Medicare identity. And when they add Part B, they just add an effective date for Part B to that.
Now, what health savings accounts, though, it can affect their eligibility for an HSA, right?
As long as they stay on their company plan, they're still eligible for their HSA. As long as they stay and that plan remains primary.
Okay, we're visiting with Kevin Kragenbrink. We're talking about the ins and outs of Medicare. When we come back, we'll start getting into some specifics about Part B, which you do pay for, and that's, and then Part D for drugs, and then getting a supplement. We're going to dive into all things Medicare. So stay with us. This is More Living with Jim Brogan here on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Welcome back to More Living right here on News Talk 98.7 WOKI. We're visiting with Kevin Kragenbrink, and we're talking about Medicare rules. So let's get into Part B, Kevin. And what does Part B cover? What does it not cover? Many people think it automatically Medicare is going to cover most of their health expenses. Not necessarily true. So can you walk us through that?
Yeah, so Part B is coverage. The general way to say that would be it covers doctor's office visits and the things associated with doctor's office visits. So it'll cover some X-ray lab, that sort of thing. But both Part A and Part B don't cover 100% of cost anyway. There is a co-insurance element to Medicare. Again, as a general rule, we say that they cover about 80%, and you're left with the 20% to cover for yourself. But the other thing is that neither Part A nor Part B covers prescription drugs. Now, prescription drugs, if you're in the hospital and you're paying for a prescription drug while you're hospitalized, as part of that hospital care, that's covered by Part A. But all the other prescription drugs you might take are not covered by either Part A or Part B. Those have to be covered by Part D.
Right. So then that's added too. And then how would somebody talk about supplements, Medicare Advantage? What are the differences in some of those things?
Well, that's a huge question. Do we have time?
We'll dive into because that's where most people get a little bit sideways and the differences between a supplement and advantage. Walk us through. Why don't we start that and we'll just keep going?
Yeah, absolutely. So the first thing I like people to know about that is that because we have supplements and Medicare Advantage plans available to us, we can effectively cover all or most of the out-of-pocket costs for our health insurance through either a supplement or a Medicare Advantage plan. And there are trade-offs depending on which route you want to go and how you want to manage your own health care. And it's really about how do you...
Yeah, what's the difference between the supplement and the Medicare Advantage?
So there are some core differences. Supplement plans cover out-of-pocket costs. And the first advantage people find with supplement plans is that supplement plans do that without having any consideration for networks of doctors. So any doctor who's on who accepts Medicare will accept your supplement plan. You don't have to worry about networks or whatever you need to do with that. And a lot of people like supplements just for that reason alone. A second thing about those supplements is that typically there is up to, if you get a Plan G, up to 100% coverage for all of your out-of-pocket expenses after you pay your Part B deductible. There is a Part B deductible. It's a small amount. For 2026, it's projected to be about $288. Once that deductible is paid, then you can get all of your out-of-pocket expenses covered, or some of them, depending on which supplement plan you choose. So
let's go into the supplement plans, and then we'll circle around to Medicare Advantage. The supplement plans, they have the different letters.
They do.
So I guess the ones less expensive are going to have more out-of-pocket utilization cost.
Correct.
If you pay more premium, you're going to have less utilization. So at some degree, you can kind of control what those costs are going to look like.
To some degree, that's exactly correct. There is an initial premium, which for most people, if you start at 65, your initial premium is going to be low, and most of the carriers will lock that premium in for the first 3 to 5 years. So you have a premium, you know that's going to be your premium from, say, 65 to 70. But a downside to the supplements is that premium can go up, and it can go up in two ways. There can be an annual adjustment that everybody pays due to cost of living, and then there can be a policy-based adjustment that the insurance company can apply, typically based on age. And so most people, by the time they hit 70, are starting to see that supplement premium cost go up every year. And for some people with some carriers, it can go up quite substantially. I've seen some that stay fairly reasonable. Maybe they go up from starting at $135 a month. They might go up to $240 or $250 or even $280 a month by the time they're in their mid-70s. But for some people, I've seen their plans go up to $350 or $400 a month by the time they're in their mid-70s. So it's really about the carrier, the plan, and those sorts of things. And that is, if there's a real downside to the supplement plans, that's it, is that there is no control over the future of those premiums. And as you age, they can become burdensome.
And so then contrast that with the Medicare Advantage.
Yeah. So the Medicare Advantage plans, there are a wide range of them in our area. Most of the carriers offer Medicare Advantage. Most of the Medicare Advantage plans offered in our area are HMO plans, which means you have to use their network. And you do have to have an assigned primary care doctor and those sorts of things. Some of the plans locally, it used to be that almost all the plans locally, Jim, had no referral required for specialists. But that's one of the big changes this year is several of the major carriers are changing that rule this year, and they're going to require, starting in 2026, that you have a referral to see a specialist within the plan. But there are still some that don't. So you can have some plans that require referrals and some that don't. And the way they work, typically you could get a zero premium plan. And the trade-off for paying no premium is that there's a max out-of-pocket that you would be spend. And those max out-of-pockets range everywhere from $3,500 up to $6,500. You get to choose. And then the benefits within the plan are typically administered through copays, like a typical commercial plan would be. So I might pay nothing to see my primary care doctor, but I might pay $30 to go see a specialist. And
then that all adds up to the out-of-pocket max.
That all adds up to the out-of-pocket.
But then if you go in the hospital or that kind of, then you're going to have some copay or some co-insurance, or how does that work on the Medicare
Mostly
Advantage?
copays, even still.
Okay.
There can be some things that are a co-insurance, a percentage of the total cost, but everything goes into that max out-of-pocket. So if I hit to that $3,500 number, that's it. You know, if that's my max out-of-pocket for the year, then I'm done for the year. I pay nothing more, right? And so sometimes it's a trade-off between looking at the premium cost versus the out-of-pocket max. So I want to do a supplement.
And choice of doctors.
Yeah, and choice of doctors. That's correct. All of the major carriers, by the way, several years ago went to they have a local network that you do have to use. But there used to be a concern about traveling. If I'm going to go 30 days to Texas to visit my grandkids, will I have a network there? And all the major carriers in our area went to a national network for travel several years ago. So there's no real risk of not having coverage in a remote or in another state.
So now can we switch back and forth between a supplement and Medicare Advantage or vice versa?
Yes and no. Yeah, let's do that. The yes is you can always switch to another Medicare Advantage plan during the annual enrollment period, which is where we are now. So you could say, I had this Medicare Advantage plan, but the network's not working for me, or their changes for next year don't match up for me. I can change that, and there's no restriction on that change.
You can go to a supplement.
No, you can go to a Medicare Advantage plan.
Oh, okay.
If I want to go to a supplement, then I might be subject to underwriting if I didn't have a supplement before. So if I started out with Medicare Advantage, and I decide all of a sudden that I want to go to a supplement plan this year instead of the Medicare Advantage plan, then I'm going to have to answer medical questions and go through medical underwriting. And technically, the insurance company could decline me. Most of the time, what I see, if there are medical issues, is I see an increased premium.
So, now what about going from a supplement to Medicare Advantage?
No restriction.
Okay, that's what I thought. So a lot of flexibility. If you're in a supplement, you've got some flexibility there. But if you're in Medicare Advantage, not as much. So it's a very important decision up front, seems like to me.
It is, and a lot of people make that decision for just that very reason. That they look at it and they say, "Well, I need to go on a Medicare supplement now because if I don't, I won't be able to go on that plan later. I might not be able to," and they make that decision for that purpose, which I fully understand why they would make that decision. But the thing I encourage people to weigh out in that process is to ask yourself the question: if the premium on that Medicare Advantage plan in 10 years goes up to the point where you're paying more in premium than you would pay max out of pocket on a Medicare Advantage plan, are you still in the right place?
A lot to balance there. Do you have some, I guess you've probably seen some real-world examples where people have either been able to save a good bit of money or else maybe enhance their coverage by understanding their options better?
Absolutely. I'll give you one real-world example. I met about 5 years ago a nice lady who was in her early 80s, and she had been on a Medicare supplement plan from the start when she first went on Medicare at 65. She had been on that same Medicare supplement plan for, I think, about 18 years at that point in time. And unfortunately, her premiums had gone up to over $500 a month. So she was paying over...
Now, is that kind of normal to see that?
I haven't looked at that many in their 80s who are on supplements, so I can't answer that in terms of normal. It's not abnormal, though.
Okay, gotcha.
There was nothing extraordinary about her circumstance that made hers higher than somebody else's would have been. And so she was paying well over $6,000 a year in premium cost so that she had no out-of-pocket medical cost. But networks were not a problem for her. So I was able to show her a plan there where we were able to move her to a Medicare Advantage plan with a $3,500 max out-of-pocket. And she didn't even have to change any of her doctors to do it. And she now had she was saving over $3,000 a year by moving to that Medicare Advantage plan at that point.
Now, just to be clear, in terms of the open enrollment period, is that when you can switch between supplement plans?
Well, yes, but it's one of the crazy things about Medicare is all the different ways they use language. And it can get so confusing, right? So this is not technically open enrollment. This is annual enrollment. And it's important because there's a distinction. There is actually an open enrollment period that starts January 1st. And the difference there is during the annual enrollment period, October 15th to December 7th, I can change just about anything in regard to my Medicare with no reason whatsoever. I just want to make a change.
So you could change your supplement plan.
You could. I can change just about anything during this period. My prescription drug plan, my supplement plan, my Medicare Advantage plan. I can make any change during the annual enrollment period. The open enrollment period is only for people who want to leave a Medicare Advantage plan. So I got a Medicare Advantage plan. It's January 15th, and for some reason I need to leave that plan. I can do that during the open enrollment period. I can go back to original Medicare, which means a supplement, or I can just drop my plan completely and add nothing else.
And the supplements are very regulated, right? I mean, a different G plan, I mean, with one carrier versus another are going to be the same, right?
That is exactly correct. The plans types are defined by the organization that controls Medicare is CMS, the Center for Medicare and Medicaid Services, and they define what a Plan G looks like, what a Plan K looks like, what a Plan N looks like. That is defined by them. And the carriers only have the ability to change the premium cost, basically.
So what drives people's decision on what insurance company to use? Is it the drug formularies?
It can be, but if you're going to do supplements, the prescription drug plan is a totally separate beast. And so you could have, and I have many clients like this. You can have somebody who's got a Humana Plan G Medicare supplement, but they've got an Aetna prescription drug plan or a United Healthcare prescription drug plan because the pharmacy network they want or the formulary that they want or the price.
So what's driving people's decision for their regular supplement in terms of what insurance company?
My honest opinion there, mostly about what the agent is presenting them, and then the price. Because agents do present, every agent doesn't represent every insurance company. And oftentimes they'll go and they'll present what they think is the best plan based on the companies they represent, and that just becomes the way that plays out in terms of how they get that plan.
Okay, that brings up a lot of interesting things. I actually want to talk to you a little bit about going through that process. But I tell you what, we're going to get to our next break. And when we come back, we are also going to have our dollars and cents segment, understanding the numbers on your tax return and how it can affect things like Medicare premium for Part B and Part D, as well as taxation of Social Security benefits. So stay with us. This is More Living with Jim Brogan here on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Thanks for tuning in to More Living with Jim Brogan here on News Talk 98.7 WOKI. We're visiting with Kevin Kragenbrink. We're talking about Medicare decisions and kind of the ins and outs of that. Before we get back to Kevin, however, it is time for dollars and cents.
Want to be sure you are getting the most out of your retirement? For all the years of your retirement? That's the primary goal of More Living with Jim Brogan and our Dollars and Cents segment, where we provide you with an important financial tip that will help positively impact the quality of your life in retirement. And now, here's Jim with this week's Dollars and Cents tip.
Understanding how the tax return affects your Medicare premium as well as your Social Security taxation. So it's really it's important to understand how the different things on the tax return are related. And I like to compare, there's two important numbers on the tax return. One is adjusted gross income or modified adjusted gross income, which is simply your adjusted gross income plus any tax-free municipal bond income that you receive, is a part of the equation for both Medicare premium and for taxation of Social Security benefits. So the difference in modified adjusted gross income and taxable income. So your taxable income is then after you have your deductions. Now, prior to the extension of the Tax Cuts and Jobs Act, or the One Big Beautiful Bill Act is a better way to say that, now that that's happened, we have some certainty moving forward. But, after the Tax Cuts and Jobs Act, roughly 90% of U.S. Working Americans were not itemizing their deductions. But whether you're itemizing or not, the taxable income is the number after your deductions. So what's important to understand is that modified adjusted gross income number is what drives your Medicare premium and your taxation of Social Security benefit. It is not the taxable income number. So when you start planning for these kind of things, it is important to understand those relationships, because if you're doing tax planning, you're looking at taxable income. If you're looking at things like Roth conversions, which we talk about on this show, or if we're talking about realizing long-term capital gains at an improved tax rate, we're looking at the tax bracket itself, which is taxable income. But Medicare premium and taxation of Social Security benefits is driven more by that adjusted gross income number. So the way I would kind of explain that is it's kind of like shooting out a pinball. And, the higher your adjusted gross income, the higher the pinball shoots out. And that means the more bumpers it's going to hit on the way down. And those bumpers could be exclusions or phase-outs of different kinds of tax. It also could be extra premium for Medicare, which is really what I want to focus on today, since we're talking about Medicare. As many of you know, there's an income-related Medicare adjustment amount that if your income gets over certain levels, so in 2025, they look back to 2023, and if your modified adjusted gross income is over $212,000 for a joint filer, you get hit with extra Medicare premium, and they have tiers, of course. They have 4 or 5 tiers. The more you make, the more you pay. So our government system for both Medicare and Social Security taxation is means tested. The more you make, the more premium you're going to have to pay, and then potentially the more tax you pay on your Social Security benefit. So it's important to understand how those numbers relate on the tax return, because if you do Roth conversion, as an example, it might cause you 2 years from now to have increased Medicare premium. But it's tricky because taxable income and adjusted gross income mean 2 different things in your planning. Taxable income is important in your overall tax planning, but a modified adjusted gross income is important when it comes to things like Medicare premium. So understanding the tax return and how these numbers are interrelated is a crucial part of planning for the financial implications of things like Medicare and Social Security benefits.
That's our Dollars and Cents segment for this week. You can find this week's Dollars and Cents segment and others by visiting BroganFinancial.com.
Check us out online, BroganFinancial.com. You can download our shows. You can stream them right there on our website. If you click on radio, you can also podcast our shows. Are on Apple Podcast and also Spotify. My last class of the fall is through Pellissippi State Community College. It's a 2-part class coming up this Tuesday. Thrive Financially in Retirement. It is the next 2 Tuesdays. 2 2-hour sessions, 6:30 to 8:30 p.m. at Hardin Valley. So very convenient, really, to all of Knoxville area. There at West Knoxville, Pellissippi Parkway. Just very convenient. So if you want more information, you can go to PellissippiRetirementPlanning.com. You can download a syllabus and you can click to register. The course fee is $59. It's $89 for a married couple through Pellissippi State. You can also call Pellissippi State directly to register, 865, of course, 539-7167. I'd love to see you at the class. It is my last set of classes for the fall. Today we're talking about Medicare decisions and kind of getting into all of those things. And, Kevin, one of the things I was thinking about in that last segment, in terms of the different supplement plans that have the letters.
Yeah.
So in the annual enrollment every year, which we're in now,
yep,
we can switch among those plans.
You can. And if you're switching carriers, you may have to go through underwriting. If you're not switching carriers, you will not have
But you could switch the different letter.
Correct.
And it seems to me like there's an ongoing management and trade-off between, if somebody has low utilization of medical, they might want a cheaper plan where they have more copays and coinsurances.
Yep.
And then if they are more utilization, they might want a richer plan. If somebody where they pay more premium, but then they know what they're going to pay.
Right.
But if they're a low utilizer, I guess that means if they become or have a new health condition that comes up and they become a more heavy utilizer, they could switch to a richer plan.
They could. That's at least theoretically, yes.
So do you see that happen? Do people manage that kind of stuff?
In my particular practice, I don't see a lot of people moving from one supplement plan to another. It's much more common in my practice to see people moving from supplement plans to Medicare Advantage plans. And occasionally I'll have somebody move from an Advantage plan to a supplement.
But changing supplement plans you don't see as much?
I don't see very much, no.
Okay. Do you see people do more? I mean, what do most people do? Are they doing kind of, is it a really pretty equal mix?
It's a mix. I think the trend has been towards Medicare Advantage. The percentage of people in Tennessee on Medicare Advantage plans has gone up every year I've been in this business.
You think some of that, the national network, has really helped with some of that?
I think that's been huge. I think education has helped a lot. The carriers are really trying to do a good job of educating people on what those plans are and are not, because Medicare Advantage plans got a bad rap 10 years ago, 12 years ago. A lot of people were just afraid of them. The networks thing scared a lot of people. But I think the carriers have done a better job of educating agents and consumers on what those plans do and can do. So.
Now, you mentioned the agent. So, first off, is there an extra expense in utilizing an independent insurance agent to help with their Medicare decisions and their supplements?
There is not. The agents are paid through the carriers. Now, I suppose there are exceptions. There may be some advisors out there who charge an advisory fee, and that certainly I don't think that would be unallowed, but it'd be pretty rare. I certainly don't know any advisors that are charging a fee at all. Because all of the advisors are paid a commission, and it's big. You can't get a lower price plan by not going with an advisor.
Which is kind of where I was going.
Yeah.
And then the agent can also actually help you enroll in your Part B and Part D.
They can, absolutely. That's the whole point, is that the agent is there to walk you through the process, advise you, give you a look at. Hopefully that independent agent is giving you a look at lots of different plans so that you can make an informed decision about what's going to be best for your health care. The agent is required to help you make sure that your plan is going to cover your prescription drugs, that if you're going on a network-based plan, that the doctors are in the network. That's part of the process we are, I say required to do. It's not a law, but it is part of our code of ethics that says, if you come to me, I'm going to ask you about your doctors to make sure they're in network. I'm going to ask you about your prescription drugs to make sure they're in the formulary, so that you're not caught in a place where you're not covered for something.
Well, very important for sure. Now, you mentioned in the last segment that, because I said, why do people choose one insurance company over another on the supplement side? And you said it depends. Is the agent paid more by one company or another? Talk about the importance of independent agents. How big of a conflict is this?
Yeah. Well, and I have to be careful there, right? Because the agents aren't actually necessarily paid more by one company or another, because the amounts that the agents are paid are actually set by CMS.
Okay, well, I'm glad I asked for that clarity.
Yeah. So CMS tells the insurance companies, you can pay your agents this much, and that's that. And now the insurance company can choose to pay you less, but they really don't. They know that for them to be competitive, most of those insurance companies are going to pay what's available. There are plans out there that are non-commissionable that agents will offer at times, but there's specific plans covering specific types of things. And there's an exception to this, Jim. I hope we get a chance to talk a little bit more about prescription drugs, because that's the biggest area of change for this year. And so there are some prescription drug plans that are non-commissionable this year that's a big change. But so when an agent is presenting plans, oftentimes they're presenting plans based on their relationship with the carrier, their understanding of how that carrier is doing in terms of managing claims, handling customer service complaints, all of those sorts of things.
Which are all important things.
They are hugely important, because most of the time if I get a call from one of my clients during the year, it's typically because something that they thought was going to be covered wasn't, or more often they're trying to get information from the insurance carrier and they're having a hard time doing it, and that's a customer service issue.
We're visiting with Kevin Kragenbrink. We're talking about Medicare benefits. When we come back, I do want to get more into the drug stuff and what's changed for 2025 and moving forward. And then we'll also talk about many of you listening, or your parents are navigating this. How can we as adult children help our parents? So stay with us. This is More Living with Jim Brogan here on News Talk 98.7 WOKI.
Welcome back to News Talk 98.7's Brogan Financial Studios, where Jim Brogan is coming to you live with important news and advice to help you achieve your dream retirement. Get ready to learn and live. Here's your host, Jim Brogan.
Welcome back to More Living here on News Talk 98.7 WOKI. As we're talking about the ins and outs of Medicare, we can talk about this for hours, and unfortunately we're almost out of time. But let's talk about the drug stuff. How have new Medicare rules, how are they changing the way people pay for their medications, especially in 2025 and beyond?
Yeah. So the Biden administration in their last year passed a law that really changed the way the Part D plans were built. And the most significant change, and it was a real benefit to the Medicare community, is that they lowered the max out-of-pocket. So prior to 2025, the max out-of-pocket for Part B drugs was $6,800. In 2025, that dropped down to $2,000. And for 2026, it's going to be $2,100. So it's still very, very low. And that's the true max out-of-pocket for your Medicare prescription drugs. But along with that, the carriers had to make some adaptations because it's a huge change to what the carriers are responsible for in terms of getting those plans out there. And so we're seeing a couple of things happen. One, we're seeing a consolidation of prescription drug plans. So many of the carriers used to offer 3 or some even 4 different prescription drug plans. Those are typically now narrowed down to only 2 per carrier. There's what they might call a value plan and a premium plan. We're seeing a tightening of drug formularies. And so one thing I'm encouraging everybody that I talk to about Medicare for this year is look carefully at the drug formulary for next year for your prescription drug plan.
Don't make assumptions about what you've currently had covered.
Exactly correct, because there are big changes happening. And then the other thing that changed is that there used to be a lot of plans that did not have any deductible on Part D prescription drugs. Almost every plan now, not every plan, but almost every plan I'm seeing available to us here in East Tennessee has a deductible. And those can range anywhere from $250 up to about $625 as a deductible on your Part B prescription drugs that you could end up having to pay. Most of those deductibles don't apply to generic drugs. They don't apply until you get to level 3 or 4, tier 3 or 4 drugs. But they're still out there, and it's new. And even some of the Medicare Advantage plans that incorporate the prescription drug plan into the plan itself are seeing those deductibles come into play this year.
Okay, so people really need to be aware of that, especially in this open enrollment, or excuse me, annual enrollment.
That's
period,
right.
Excuse me. We get people ask people, a lot, how do I budget for healthcare expenses in retirement? And then you see studies that the average 65-year-old is going to spend $300,000 to $350,000 on Medicare, counting premiums, utilization, all in for their lifetime. But the reality is, we don't retire or go on Medicare at 65 and stroke a check for $300,000. It's
right.
Part of an annual budget. Do you have any tips of how people can budget and predict their health care spending in retirement?
Yeah, I mean, my tip is, just exactly what we've already laid it out, I think, Jim. It's take a hard look at, do I want to go with a monthly fixed premium cost that covers basically all my out-of-pocket expenses except for prescription drugs? And that's my number, right? So if I'm going to go with $150 a month for prescription drugs, for a Part B supplement, and then I'm going to go to maybe $60 a month for a Part D prescription drug plan. So I'm at $210 a month. That's my premium cost. And then my max out of pocket is $2,000. That's my budget.
And then you've got your Medicare Part B as well.
That's correct. Everything is in there, and then your Part B.
You got to plan all those premiums.
And we know all of those numbers are going to change annually, but they're budgetable. They're somewhat predictable. They're not going to change radically from year to year. If I do the same, I take the same approach with the Medicare Advantage plan. I say, okay, I'm not worried about premium, but I still am going to have my max out of pocket, maybe $3,500, maybe $4,000, plus my prescription drug max out of pocket. That's my budgeted amount.
Okay, so I'm about out of time here, but I do want to ask you this question. Many adult children, we help our parents navigate these kinds of decisions. What advice do you have for families trying to support their aging parents with their Medicare choices, and what should they be doing before it's too urgent?
Yeah, I don't want to sound self-serving, but what I want to say is meet somebody who you trust as an agent. There are a lot of good agents out there, and there are some not-so-good agents out there. Find a trusted advisor. Just like
that's an independent agent. And so, Kevin, how can people learn about your company?
Yeah, they can call me directly. My number is 865-804-1556, and I would be happy to talk with them.
Okay, 804-1556.
Correct.
Okay, that's Kevin Kragenbrink, who specializes in Medicare. Today we've been discussing health care because greater health provides for more living so you can live the best years of your life your way. Many thanks to Wayne helping engineer the show, and thanks to Mary Caroline for helping produce the show. Have a blessed weekend on this third Saturday in October. Go Big Orange. You've been listening to More Living with Jim Brogan here on News Talk 98.7 WOKI.
The views expressed by Jim Brogan and his guests are not that of Cumulus Media. Any discussion of financial, legal, and tax planning strategies is not intended to be individualized advice and is general in nature. Always consult with your advisor for advice specific to your needs. This program's content does not represent a recommendation of any particular security, strategy, or investment by Jim Brogan or Brogan Financial Incorporated.